Good afternoon, producers. It's Friday afternoon, the 20th of March 2026. I'm Frikkie Mare, CEO of the Red Meat Producers Organization. I would like again to give you an update on what the weekly situation on foot and mouth disease. I think this past week, not a lot of progress have been made as we like to see, but let's look at what we have and then we take it from there again. First thing is, last week I talked about a Section 9 and the Section 10 articles that we are busy with. And when I say we, it's the government and the technical task team and the industry. Unfortunately, last week they said they were busy with it and they're looking at it, and we received no feedback during this week. Not the recommendations from the MTT, nothing from the department. Last week from industry side, we requested that we sit together in a room, have a workshop, go through these documents, finalize them as they are quite important. Section 9 again is the control measures, what to do with animals and products and etc. And Section 10 is the scheme for preemptive vaccination, where when there's enough vaccines you can apply to get vaccinated. But currently, unfortunately, according to the industry, no progress has been made as we didn't receive any updates. Why are these so important and why are we keep pressing for it? We are rolling out vaccines. We are putting vaccines in animals. There's positive areas that have not been vaccinated yet. But even the vaccinated animals, we do not know what to do with them. Weaner calves, where can we sell them to? When can we move them? If your whole farm has been vaccinated, how long until you are no longer under quarantine? Section 9 should provide these details. It should provide clarity on how you treat animals and products. We don't have these regulations. Why is Section 10 important? We must remember that even though we are going to vaccinate the whole country, Section 10 is for preemptive vaccination. So that means that a stud breeder who vaccinate his animals, even although he's not in a positive area, can safely sell those bulls to other producers as they have been vaccinated and should not have FMD. It means that feedlots can vaccinate preemptively calves that come in. At this stage, feedlots haven't received any vaccines. And we are afraid that at some time the red meat industry will slow down a lot as the pipeline cannot move as it wants to. Then commercial producers who want to vaccinate preemptively, they have to do it for when they purchase a new bull or heifers or other animals on their farm, and there's a risk that they can contract FMD, that they can limit this risk. So we really need the Section 10 and the Section 9 scheme quite urgently. We again requested a combined workshop with the technical task team as well as the department. We feel that the only way that we are going to finalize these documents is if we sit together in a room, finalize the documents, let us all get on the same page, and then take it further. Last week I talked to you about a survey that the RPO, together with the veterinary network, Dr. Dani Orendal, sent out, where producers can indicate if they want to take part in a preemptive vaccination drive. We received about 200 feedback or 200 responses up to date, and that data is quite important. Dr. Dani gave me a quick overview of what we have so far, and I think that is exactly the data we need to really push, especially the Section 10 forward. It shows that producers are willing to vaccinate, that they have the correct animal handling facilities, that the animals are already individually numbered, that the processes are in place, and that vaccination, if the vaccines is available, should be done quite easily. Let's talk a bit about vaccine availability. We all know the vaccines that in the country are currently being rolled out, but they're not going to last for always. So we need new batches to come in. There is 5 million Biogenesis Bargo from Argentina vaccines ready. Apparently they are in Europe, and they are kept for South Africa. It's set 1, 2 and 3 strains that's in it, but we are still waiting for the Section 21 approval. From what we could find out is that because the previous batch only contained SAT 1 and 2, they now need a per bright report on the SAT 3 strain to make sure it's compatible and it is there and that it will work, and we will apparently get that report next week, and hopefully we can then get a Section 21 import permit so that the Section 21 permit so that the department can issue an import permit so that those vaccines can be imported. Approval is really urgent at this stage. The other vaccines that's in the pipeline is those of Tolvet. There's also a Section 21 submitted that we are waiting for. So at this stage, our I almost want to say our future is in the hands of SALPRA to approve those Section 21 permits so that we can import the vaccines. But the vaccine rollout, or in terms of the vaccine rollout, we are really concerned, and especially for commercial producers in some of the provinces. When national allocated vaccines, they allocate it to provinces, and then on provincial level they decide how they will distribute these vaccines between dairies and positive areas, and communal and commercial farmers, etc. In some of the provinces, they are doing a sterling job. They are vaccinating the positive areas, no matter what type of animal it is. But that is not the case in all the provinces. In some of the provinces, the commercial farmers have received almost no vaccines. In KwaZulu-Natal, for example, only the Tolvet vaccines, they received 560,000 doses of Tolvet. 185,000 was distributed to the dairy producers for vaccination, and all the beef cattle of the dairy producers was also vaccinated to vaccinate all the animals on the farm. But for commercial beef producers, and that includes stud breeders, commercial in the economic sense of the word, they have in total allocated 20,000 doses. 20,000 of 560,000 doses. The rest of the vaccines went for communal vaccination. There's no argument to make on how this was decided on. The fact of the matter is, if you want to win this disease, then vaccines must be rolled out according to areas that is affected. We have to vaccinate around the positive areas to prevent the further spread. And once we have contained the virus, then we can move inward and outward. To vaccinate preemptively in communal areas, for example, is not helping us at this stage, and it feels like we are wasting vaccine that is a scarce commodity, as new Section 21 approvals have not been approved yet. As the industry, we are taking it up with the national department to align how vaccines must be rolled out. We need clear, consistent guidance on this to make sure that no one can be benefited from the vaccines. Positive farms, surrounding farms must be vaccinated. Vaccines can never be allocated based on the type of farmer. It must be a risk-based allocation, and we are pushing out for that. Lastly, there was a report a day or two ago on the meat market, or especially the retail market, on red meat from some of the retailers, where they stated how much the red meat market have basically decreased, people buying less red meat, and they attributed it to FMD. We immediately got questions on, but is the meat safe? Consumers are afraid. I think FMD have contributed in two ways to the reduction in the sales of red meat. One is, yes, there may be some consumers that's a bit afraid and do not know all the facts around the virus. From the RPO side, I have done multiple interviews on radio, television, articles in magazines, in newspapers, to put a message out that a product is safe, and we will continue to do so and are looking at alternative ways to get this message out. The other thing is, however, the price of the product currently. Prices have increased sharply, especially shelf prices as well, due to FMD. And it's due to a lot of factors, not only the bottlenecks in the supply chain, but also the uncertainty. When you are a retailer and you purchase from one abattoir or wholesaler, and there comes a problem, then you suddenly have to find alternatives, and then prices are drive up because the demand just in the short term quickly increases and drive prices up. The other problem is with our export markets. The current war in Iran doesn't help. We are exporting a lot of meat to that Middle Eastern countries, and currently there are also bottlenecks. We need to make sure that our consumers in South Africa can have access to a safe, affordable product, and we have to make sure that we can export a product. And the only way we can do this is to get enough vaccines, vaccinate the animals, establish export markets based on vaccinated animals, like Brazil and Argentina did. They have exported meat while they were vaccinating the whole time. If we cannot do this, we are in for a rough ride in the red meat sector. We cannot produce a product if we don't have a market to sell it to. So we have to ensure consumers of the safety of the product, and we have to be able to clear out the bottlenecks to make sure the panic buying and the sharp increases in price are not there, to ensure a consistent supply of the product. I hope you enjoy the weekend, and hopefully there's more progress and better news next week. Goodbye.